Hello everybody. I'm so glad to be able to talk to you today. My name is Dr. Marvia Jones. I am the Health Director at the Kansas City, Missouri Health Department. I wanted to talk to you a little bit today about where we are with COVID-19. Some folks are wondering where we stand right now. You're hearing about surges nationally and at the state level, and here as well in Kansas City we are seeing an uptick in cases of COVID-19. We've also seen a bit of an uptick in hospitalizations, about an 18% increase over the past couple of weeks. And so what we know is that the vaccine, thankfully, the COVID-19 vaccine still protects against severe illness and hospitalizations. And so that is encouraging to hear. Yes, some of us may still test positive even though we have been vaccinated, but what we are seeing by and large is that most folks who have been vaccinated are not getting severely ill and winding up needing hospitalization. Now, the big question that a lot of people have is regarding the mask. As you know, right now, the city of Kansas City, Missouri does not have a mask mandate, which means that, as you've noticed, you've gone into businesses and eateries, and you have not been required to wear a mask. And so many people wonder, do they need to wear them and what is the benefit? At this time, as of today, with the data that we have now, especially with the uptick in cases that we are seeing, we do recommend that people who are at high risk for severe illness to wear a mask when in public indoor spaces. So what that means is that if you know that you either are at high risk or you live with someone who is at high risk, that you wear a mask to protect yourself as well as your loved ones. Also, if you have traveled or you've been around other people who may have contracted COVID-19, you should also wear a mask, even if you don't think you're sick yourself, so that you can protect those around you who may be high risk. And so this is how we can take care of each other, whether we're at church or we're at our gatherings or wherever we might be. This is how we can look out for each other. Okay. And again, if you start to feel sick and you feel like you might have some symptoms, please stay home and please get a test, preferably a PCR test, so that when you find out whether you are positive, you can begin antivirals as soon as possible. And also take care of those around you. So please don't come to church or go to work or go to school or wherever if you have any symptoms. Also, it's important, as I'll say again, to come and get your booster. So you can join us at the health department. You can walk in and be out in about 20 minutes and get this booster, which we know will protect those, particularly those who are at higher risk. So we appreciate all that you've already done to take care of each other. We appreciate your care and concern for those around you as well as yourselves and your families. And I want you to know that we are here at the Kansas City, Missouri Health Department for you. Thank you for everything, and I wish you well. Take care.